Bleeding in pregnancy, early in pregnancy, can be a bad thing, but most of the time it's not. It is the scariest thing, though, and that's what can be most distressing. But most of the time it's explained by something simple. It's not uncommon, about 20 to 40% on average. You'll see different statistics, but around 30% of women will bleed in early pregnancy and still have a normal outcome. Some of the most common causes are some of the simplest things, such as something on the cervix, whether it be an infection, a polyp, just irritability to the cervix that can be caused by excess blood vessels that are forming due to the hormones in pregnancy. They can bleed a little bit. Sometimes a polyp, which is just a little skin growth, can cause bleeding. Those are the most kind of benign, easy causes or things that aren't worrisome. Some of the more serious things to worry about in bleeding in early pregnancy would be an ectopic pregnancy. An ectopic pregnancy is where the pregnancy develops outside of the uterus, not inside the uterine cavity, and it shouldn't. Most of the time it develops in the tube or out at the end of the tube on the ovary, and those can be very dangerous, and some of the symptoms can be mild bleeding. The other thing that's serious or worrisome is, could it be indicative of a miscarriage in progress? But typically, though, that will be heavy bleeding with severe cramping. The ectopic pregnancy may still be light bleeding, but it'll usually be associated also with pain, particularly on one side of the abdomen. You know, a lot of people ask, when should I worry about bleeding? If it's light, if it's not associated with heavy cramping or anything, most likely it's not anything to worry about. But feel free to call your doctor to find out, give them the specific symptoms and they'll help you walk through it. If it's heavy and cramping, yes, we definitely want to hear from you, or if it's so heavy you need to go to the emergency room, go to the emergency room. We can evaluate you in the office with ultrasounds, sometimes we'll draw different hormonal levels, HCG and progesterone levels, and follow those to get a better answer and a quicker answer for you. Definitely, if there's any questions, feel free to call.